So we have Dr. Tom O'Brien. Sir, you have reached this event which is based on gut health and lifestyle disorders. So how is your experience and what message would you like to convey to the people?
The message of the conference is that all disease begins in the gut. It doesn't matter what the disease is, if it's cancer or diabetes, rheumatoid arthritis, multiple sclerosis, all disease begins in the gut. That if there's one thing you're going to do to be healthier, it's learn how to build a healthier, more diverse microbiome, the good bacteria. Learn how to feed the good bacteria and stop feeding the bad bacteria. All of the whites feed the bad bacteria. White bread, white rice, white sugar. They all feed the bad bacteria. And then the bad bacteria, if I exercise too hard and my muscle is sore the next day, that's lactic acid. Everybody knows that. Just drink some water and you'll be fine in a day or two. It's the exhaust of the muscle cells. The bacteria have exhaust, and the exhaust go into the bloodstream and they send messages to your heart, to your brain, to your liver. And so if you have too many bad bacteria, the message is inflammation throughout your body. And it's always inflammation that causes disease. So you want a dominance of the good bacteria, not as many bad bacteria. That's the bottom line message.
So we are talking about gut. So what are the symptoms when we should consider with the doctors?
What is not a symptom that is associated with the gut? Migraines, you have to treat the gut, along with the pain. Joint pain, you have to treat the gut, along with the local pain, but you have to treat the gut because the messengers of inflammation are coming from the gut. So it doesn't matter what the symptom is. People have to understand this. All disease begins in the gut. Well, what about viral infection? All disease begins in the gut, right? And when we understand that, then we realize we always include treating the gut with whatever symptoms you have.
So we have heard about a test, food intolerance test. How beneficial is that for the patients?
Yeah, it's very important. The most common source of inflammation is what is on the end of your fork. Food. It's the most common source of inflammation. And people think, well, I don't feel bad when I eat wheat. I don't feel bad. But the science tells us only 1 person out of 8 has stomach problems from wheat. The other 7 out of 8 have brain problems. They've got brain fog or depression or anxiety, or they've got joint problems, or they've got skin problems. They don't have gut symptoms. So you eat the wheat and you think you're fine, but actually you think you're fine because the gut's not acting up. It's some other area that's acting up.
Importance of millets in our nuts.
Yeah, critically important. Millet is one of the safe foods that's very high in nutrition, and it should be a part of everyone's diet at least every few days, if not every day.
Thank you very much for talking.
Thank you.
Thanks for precious time.
Thank you so much.
So he was Dr. Tom with us.